Hey everyone, welcome to What's Up Wednesday with Dr. Jen. That's me, board certified pediatrician, spokesperson for the American Academy of Pediatrics, parenting expert, and mom of 3. And I'm here today talking all about antibiotics in kids. In fact, this week is World Antibiotic Awareness Week. So talking all about the importance of antibiotics, how to use them correctly, not to overuse them. Why? Because it can cause resistance, which is not good, SuperBugs, and then we have problems when we need antibiotics for our kids and our families. So it's really important to use antibiotics only when necessary. Always consulting with your pediatrician when it comes to your kids as well too. And so yes, today really going to focus on surviving those illnesses when your doctor does not prescribe an antibiotic or an antibiotic is not needed. Like, what do you do? How do you take care of your kid? How do you get them to feel better? You know, we always sometimes want those antibiotics. So we're going to talk about how to use antibiotics appropriately and what else we can do. And I know it's all about balance, right? As a mom, and I have lots of dads also that watched me on Ask Dr. Jen, but I think it's really important to listen in because, you know, obviously our kids get sick a lot, and it's not your fault, it just happens. Kids get sick a lot. And it's hard because when they're not eating well, parents get so upset, right, when their kids are not eating well, and they're not sleeping well, and you're tired, and you're cranky, and they're cranky, and, you know, it's really hard to sort of balance everything that's going on in your life. You just want a quick fix so you can get them better. But antibiotics is not always the answer. In fact, over 2 million people a year get antibiotic-resistant organisms and infections, and 23,000 die per year because they don't have antibiotics that work on these infections. So it's really important, as I said. We're going to talk all about antibiotics today. So ask any questions below, and I'll try to answer them either afterwards or as I go along as well too. But as I said, let's talk about antibiotics in kids. So to start with, antibiotics only treat bacterial infections. True or false? Actually, it's true. So antibiotics only help bacterial infections. And let me give you a little tip. Most of the infections that your kids are going to get are not bacterial infections. They get a lot of viruses, right? A lot of colds. They get, in fact, 6 to 9 colds a year, plus throw in croup and ear infections and strep throat sometimes and stomach bugs. They seem like they're sick all the time, and probably because they are. Kids, though, who get sick a lot in nursery school, right, in daycare, they actually have been shown in studies to get less sick when they're in elementary school. So it's kind of like getting some of it out of the way, right, and building up their immune system. And when it comes to infections that are not so serious, yes, it's okay to get them, and it can help your body. But obviously, infections that are really severe, they need to be treated. And always important to go to your pediatrician if your child is really ill or has fever for more than a few days, is not getting better. Always want to check it out and make sure that it is being treated appropriately. So saying that too, you know, when you hear buzzwords, or if someone has a follow-up with me and they went to another doctor or they went to a clinic, or they said they put them on antibiotics because they had a red throat or they had green snot, or they had chest congestion, that's not really a diagnosis, and that's not a bacterial infection, and in fact they may not even need an antibiotic. So when do you know if you need an antibiotic? So you should bring your child to their pediatrician to be seen, a full history, a full examination, and we treat bacterial infections based off of usually studies. So right, so something, if they had example, a chest x-ray, they had a strep test, a urine test, a blood test, cultures, stool cultures, things that show a specific bacterial infection. Those you want to then treat with an antibiotic because you know what you're treating for. So you want to make sure that you are using antibiotics only in those specific cases when you need them. Again, like if there's a skin infection like impetigo or something like that, that is a known bacterial infection, or an abscess that has to be drained, and you culture it, and you also know what to give them as well too. Really, really important. And that's why you have to go to the pediatrician to be seen. When also do you use antibiotics? Well, also you want to make sure that you're using them, as I said, properly. So you don't want to just use the other sibling's antibiotic that you have laying around at home. Why? Because you may not have enough left to treat. Antibiotics in kids are done by weight. So one dose for one child may not be the right dose for your other child. It's also because not all, but most antibiotics for kids are liquid form when they're young. There's different concentrations. So it may on the bottle say a teaspoon for your 10-year-old and a teaspoon for your 3-year-old. The concentrations may be different, so you don't want to mix them up. You don't want to share because you could be giving the wrong dose. You also want to give for the whole time and treat whatever your doctor says. So now it depends. You know, it used to always just be or everyone said you had to treat for 10 days. But there are different antibiotics now, and different infections need different amounts of time. So it may be a 1-day course, it could be a 3-day course, 5-day, 7-day, even 10 days, sometimes 14. But it all depends on what you're treating, what the child has, the infection that they have. So make sure that you follow the instructions according to your pediatrician. Always so important. And don't just stop the antibiotics yourself because the infection can come back. And again, it's another cause of resistant organisms. And talking a little bit about resistance in organisms, some misconception that parents have is that the child has become resistant or immune to some antibiotics, and that's not the case at all. What happens is that the bacteria, they become resistant to certain organisms. The bacteria become resistant to certain antibiotics, and if that's the case, then you need to have a different antibiotic and a stronger antibiotic. So we always want to start with what we call the most specific antibiotic, and then go to a more broad spectrum that covers more and more different kinds of organisms. So you want to do the sort of the least one first. So that would be something, for example, Amoxicillin is a very common one that we use in kids, and it's pretty specific for strep. And then examples it may do for some staph infections, but again, if we're thinking about MRSA or an infection, we may need other stronger staph medicines as well too, which we're seeing in New York City a lot too. So you always want to just make sure that you're speaking with your doctor, that you don't use medication that's been left over. If you finish a medication or there's some left over, you should always dispose of it properly. Don't save it for another time. It also could expire as well too, so you don't want to do that as well too. It may not be as potent if it's been sitting in your cabinet for a long time too. As I said, you don't want to share because it's also weight specific as well too. Another thing that's really important that can really help kids is to always see their pediatrician whenever possible when they're sick, as opposed, and I know you can't always do this, but as opposed to going to the emergency room or minute clinics or what have you. Sometimes that has to occur, but if you can be seen by your pediatrician, it's better for many, many reasons. One, I'm going to tell you, there's continuity of care, meaning that your pediatrician knows you, they know your family, they have a whole documented chart on your child. And so they can really look back and see, is this a new ear infection? Does it look like it's just clearing up from before? Sometimes when you just go to an emergency room, they say a little redness or a little bit of swelling or poor landmarks, and it may just be an ear